the 2021 Eingardan Albritsan. Subclade flu season is one of the most severe in decades, overwhelming hospitals and communities nationwide. A new variant of the flu virus is spreading rapidly, catching even vaccinated individuals off guard. Declining vaccination rates have left more people vulnerable, intensifying the crisis. Understanding the unique challenges of this season is crucial for an effective response. In this video, we'll break down what makes this flu season different, how it compares to recent years, and the steps you can take to stay safe. This year's surge in flu cases is being fueled by a newly evolved version of the influenza A H3N2 virus, which has taken scientists and healthcare professionals by surprise. Unlike previous years, this strain is spreading more rapidly and causing more severe symptoms in many patients, leading to increased hospitalizations and a greater strain on healthcare systems worldwide. At the heart of this surge is a genetic group known as Subclade K. This subclade is a specific branch on the virus's family tree, identified through advanced genetic sequencing and careful monitoring by virologists around the globe. What makes Subclade K particularly concerning is its unique set of mutations. These changes in the virus's genetic code allow it to slip past the immune defenses that people have built up from previous infections or vaccinations. As a result, even those who received this year's flu shot or have had the flu before may find themselves vulnerable to infection. The virus's ability to disguise itself means our immune systems are less likely to recognize and neutralize it quickly. This has real consequences for families and communities. People who usually feel protected, whether because they're young, healthy, or vaccinated, are now experiencing unexpected bouts of illness. The symptoms can range from mild to severe, and the risk of complications is higher for vulnerable groups like the elderly, young children, and those with chronic health conditions. The rapid evolution of the flu virus is not new, but Subclade K is a striking example of how quickly influenza can adapt. This constant change is the virus's main survival strategy, allowing it to infect new hosts year after year and evade the immunity that populations develop. Scientists and vaccine manufacturers work tirelessly to keep up, updating flu vaccines annually based on the most likely circulating strains. However, the process takes months, and sometimes new variants like Subclade K emerge after vaccine production is already underway. This can lead to a mismatch between the vaccine and the virus, reducing the shot's effectiveness and making outbreaks harder to control. The rise of Subclade K is a stark reminder of how unpredictable and adaptable influenza can be. It highlights the ongoing need for vigilance, research, and innovation in our fight against the flu, as well as the importance of public health measures to protect our communities each season. This season's flu rates and hospitalizations are not just echoing previous years, they're matching, and in some regions even exceeding, the high-severity season of 2024-2025. Hospitals across the country are reporting a surge in patients, with waiting rooms filled to capacity and healthcare workers stretched thin. The impact is being felt not only in major cities, but also in smaller communities, where resources are often more limited. Emergency rooms are seeing a steady stream of flu patients, and, in some cases, the influx is surpassing what was seen during the most challenging weeks of the 2024-2025 season. Ambulances are arriving more frequently, and hospital beds are filling up quickly, putting additional pressure on already overburdened staff. The early and rapid spike in cases this year signaled a tough winter ahead, catching many off guard. Unlike the milder flu seasons that occurred during the height of the COVID-19 pandemic, this year's flu has returned with a vengeance. Pharmacies are seeing long lines for flu medications, and urgent care clinics are experiencing record numbers of walk-ins. During the pandemic, widespread precautions like masking, social distancing, and remote schooling kept flu cases unusually low. But now, with those measures largely abandoned and life returning to normal, population immunity has diminished. The virus is finding more opportunities to spread, especially in crowded indoor settings where few people are taking extra precautions. This year, cases escalated earlier and faster than usual, overwhelming clinics and hospitals before many people had a chance to get vaccinated. A brief dip in reported cases during January likely reflects underreporting over the holidays, rather than a true decline in infections. Healthcare workers are working overtime to keep up with the demand, and public health officials are urging people to take the flu seriously. The CDC's data paints a clear picture. This year's flu is spreading with remarkable efficiency, straining families and healthcare systems alike. Parents are missing work to care for sick children, and hospitals are struggling to keep up with the influx of patients. The emotional and physical toll is being felt in households and medical facilities across the nation. When we compared ICU twice or so rights rakun or staction natter percent yisur ars and sur. The result is clear. Complacency is not an option. The lessons of the past few years remind us that public health measures matter and that staying vigilant through vaccination, good hygiene, and awareness remains essential to protect ourselves and our communities from the ongoing threat of the flu. Despite alarming headlines, the new Subclade K variant isn't more deadly. It's just much better at spreading. The symptoms remain the same: fever, chills, cough, congestion, body aches, headaches, and fatigue. The real danger is the sheer number of people getting sick at once, leading to more hospitalizations and deaths simply by volume. Sensational superflu narratives distract from the fact that our existing tools, vaccines, antivirals, and hygiene still work. The challenge is scale, not a new level of severity. Our focus should be on proven protective actions, not panic. Each year, scientists work tirelessly to develop a flu vaccine that targets the most likely strains to circulate. This season, the current flu vaccine isn't a perfect match for the newly dominant Subclade K, but it still offers strong protection, especially when it comes to preventing severe illness, complications, and hospitalizations. Even if you do catch the flu after being vaccinated, your chances of ending up in the hospital or facing life-threatening symptoms are dramatically reduced. The vaccine acts as a crucial shield, especially for those at higher risk, such as young children, the elderly, and people with chronic health conditions. Recent data from the Southern Hemisphere, where flu season occurs earlier, shows that the vaccine cuts flu-related hospitalizations by about 50%. That's not just a statistic, it's a life-saving difference for thousands of families. Hospitals see fewer severe cases, and healthcare workers can focus resources on those who need it most. Despite this clear benefit, vaccination rates in the US have dropped sharply in recent years. More people are skipping their annual flu shot, leaving themselves and their communities at greater risk. This decline is especially concerning as flu viruses continue to evolve and spread. Among children, only 42% have received the flu vaccine this season, a significant drop from pre-pandemic levels. Many parents remain hesitant, unsure if the vaccine is necessary or effective, but the evidence is clear. Vaccination is the best way to protect kids from serious illness. Adults aren't faring much better. Just 44% have gotten their flu shot this year, also down from before the pandemic. Misinformation, vaccine fatigue, and lingering doubts have all played a role in this decline, but the risk of severe flu remains real for everyone. The consequences are heartbreaking. Most children who died from flu last year were unvaccinated, a sobering reminder of how important this simple step can be. Each missed vaccination is a missed opportunity to save a life. The good news? It's not too late. Getting vaccinated now can still protect you, your loved ones, and your community. Every person who rolls up their sleeve helps build a stronger barrier against the flu. Every shot matters. By choosing to get vaccinated, you help slow the spread, protect the most vulnerable, and give everyone a better chance at a healthy season. As of January 2026, the CDC estimates at least 15 million flu illnesses, 180,000 hospitalizations, and 7,400 deaths, including 17 children. Hospitals are under immense strain, with crowded ERs and limited beds. These numbers are likely to rise as the season continues. The impact is nationwide, disrupting families, schools, and workplaces. High or very high flu activity is reported in nearly every state. These sobering statistics are a call to action, not panic. Vaccination, early treatment, and personal precautions are more critical than ever. While anyone can get the flu, certain groups face much higher risks of severe complications. Adults 65 and older, whose immune systems are weaker, are especially vulnerable. Young children, especially under age 2, are also at high risk, as are those with chronic conditions like asthma, heart disease, diabetes, or weakened immune systems. pregnant people face increased risks for themselves and their babies, including premature birth. For these groups, the flu can quickly become life-threatening. Annual vaccination is the best protection, especially for those most at risk. Protecting the vulnerable protects us all. Vaccination is our first line of defense, but antiviral medications like Tamiflu are vital for treatment. Antivirals work best when started within 48 hours of symptoms, reducing illness severity and duration. If you're high risk or very sick, contact your doctor quickly for testing and treatment. Subclade K remains responsive to standard antivirals, offering a reliable treatment option. Antivirals can prevent serious complications like pneumonia and save lives, especially in hospitalized patients. Remember, antivirals are not a substitute for vaccination. They're a backup plan. Using both strategies gives us the best chance to weather this severe season. Protecting yourself this flu season is straightforward and effective. Get your flu shot. It's not too late, and it's your best defense. Wash your hands frequently with soap and water, or use hand sanitizer if needed. Avoid touching your face, especially your eyes, nose, and mouth. Wear a high-quality mask in crowded indoor spaces and improve ventilation when possible. If you feel sick, stay home to recover and prevent spreading the virus. Contact your doctor early for possible antiviral treatment if you develop symptoms. By following these steps, you protect yourself, your loved ones, and help ease the burden on our healthcare system.